Good morning, ma'am. Can I start, ma'am? 11116.
Yeah. Please start. Please
Somebody help
start.
another.
Yeah, your
Okay.
topic is ophthalmic manifestations of coronavirus, no?
Yes, ma'am.
Yeah, sure.
Hello. Shall I start, ma'am?
Your slides are visible. You can
Okay,
make
ma'am.
it enlarge the slideshow.
Yes,
Yeah.
yes, ma'am. Good morning. My topic is ophthalmic manifestation of coronavirus COVID-19. As we all know, since December 2019, COVID-19 has become a global pandemic caused by the highly transmissible severe acute respiratory syndrome, SARS-CoV-2. Initially, there were several reports of eye redness and irritation in COVID-19. Patients, both anecdotal and published, suggesting that conjunctivitis is an ocular manifestation of SARS-CoV-2 infection. As conjunctivitis is a common eye condition, ophthalmologists may be the first medical professionals to evaluate a patient with COVID-19, and indeed one of the first providers to voice concerns regarding the spread of coronavirus in Chinese patients was Dr. Li Wenlang, an ophthalmologist who later died from COVID-19 and was believed to have contracted the virus from an asymptomatic glaucoma patient in his clinic. About the study, it was a cross-sectional study done from May 2021 to June 2021, and 370 patients were studied, admitted in various COVID wards. The inclusion criteria was patients diagnosed with COVID-19 who were admitted in dedicated COVID wards. Methodology: the patients were diagnosed on the basis of rapid antigen, RT-PCR, and HRCT scan. The medical history of the patients was taken. The symptoms were asked for, and bedside visual acuity was done, and torchlight examination of anterior segment was done, and posterior segment was evaluated using indirect ophthalmoscope and CT scan in patients with ocular manifestations to look for sinus and orbital involvement. The results: majority of the 68% of the patients were male, and 36% of the patients were females. And out of this, 21% were diabetics, and 31% were hypertensives. Distribution of symptoms: around 16% of the patients had redness, and 3.5% of the patients had pain or swelling of the eye, and around 2.7%, that is 10% patient complained of diminished of vision. And distribution of the ophthalmic symptoms: out of this, 72% had conjunctivitis, and 24%, around 20 patients had orbital cellulitis, and 2% of the patients had orbital cellulitis with ophthalmoplegia, and one patient had CRAO. And coming to distribution of diminished vision, the diminished vision range from CF 3 meters to PL negative status. Two patients had PL negative. And some of the patients, this patient was taken post FES, was diagnosed with COVID-19, had conjunctivitis and chemosis, and this patient had PL negative status with orbital cellulitis. He was a diabetic, uncontrolled diabetic post with COVID infection, and this patient had ophthalmoplegia with the PL negative status. She was also a diabetic. And this is the MRI scan of the same patient, had a ill-defined heterogeneous enhancing T2 stare, hyperintense soft lesion noted in the superior and medial aspect of intra and extracorneal portions of the right orbit, reaching up to the orbital apex, causing inferior displacement of the intraocular portion of the optic nerve, which caused to PL negative status. Along with that, this patient had CRAO. Discussion: the prevalence of ophthalmic manifestation in our study was 22%. Most common ocular complaint was redness, and most common ocular manifestation was conjunctivitis. Other manifestations found in our study were orbital cellulitis, ophthalmoplegia, and CRAO. Anterior segment manifestations which have been reported in other studies are conjunctival congestion, conjunctival chemosis, follicular conjunctivitis, keratoconjunctivitis, and episcleritis. And posterior segment manifestations which have been reported in other studies are CRVO, CRAO, and vasculitis. The coronavirus still remains a global pandemic with new variants emerging. The ophthalmic manifestations found have been ranging from 2 to 32%. The ophthalmic manifestation found are conjunctivitis, orbital cellulitis, ophthalmoplegia, and retinal vascular occlusion. And in India, particularly in the second wave, mucormycosis emerged as a lethal association in the second wave. So larger, more precise and specific studies are required to allow us to better understand the pattern of virulence underlying the association of SARS-CoV-2 in the eye. Thank you.
Yeah, very good presentation. Yeah, you want to
Thank you, ma'am.
add? No, my question is, all the orbital cellulitis cases had any comorbidities, or they were like?
Yes, ma'am. Yes, ma'am. Actually, most of them had very uncontrolled diabetics, ma'am, and they were in ICU and were treated with steroids, ma'am. That was the common factor, ma'am.
Okay, and all were fungal or any bacterial cellulitis?
No, ma'am. Like in our ward, we suspected that these were fungal, so we shifted them to a dedicated fungal ward, ma'am, where they were treated.
Okay, conjunctivitis, how you proved it? Like it's due to COVID?
Ma'am, as such, like studies have not found like, and it is not proved, ma'am. Some studies have found any relation is there. Maybe it is like incidentally finding, but we have found conjunctivitis in most of the patients. That is the common complaint, but it's not proved, ma'am.
Any other questions?
And how many of them? Yeah, how many of them actually had mucormycosis out of the in your study? So orbital cellulitis, yes, all the orbital cellulitis were mucormycosis.
Yes, ma'am. Like we suspected mucormycosis and we shifted them to a mucormycosis ward, ma'am. Most of them they were proved to have mucormycosis, ma'am.
All right. Okay.
Okay, so the next free paper is 1363. Is that ready? Dr. Anuj, ocular findings in critically ill patients in multidisciplinary ICUs of a tertiary medical college.
Yes, ma'am.
Yeah, please
Hello.
start. Yeah, please start the presentation.
Is it seen?
Yeah, it's
Hello.
seen. Yeah, we can see Anuj.
Yes.
Okay, ma'am. Start. Good morning. My I'm going to present my paper on the topic ocular findings in critically ill patients in multidisciplinary ICU medical college hospital. Patients in intensive care units present physicians with new challenges in diagnosis and management on a daily basis. ICU patients usually present with multiple organ dysfunctions and require multidisciplinary team management. The ophthalmic signs and symptoms often appear innocuous and may be overlooked as the physician has more life-threatening conditions. Objective to identify the type and frequency of ophthalmic disorders in ICU patients, to describe the systemic, medical, and surgical illness associated with ophthalmic findings, to assess the associations of ophthalmic findings with COVID. Inclusion all adult patients of either gender, inclusive of all GCS scores from 3 to 15, admitted in intensive care units. Exclusion patients of pediatric age less than 18 years of age, patients who refuse consent for examination. The study design is a descriptive cross-sectional study. A total of 98 patients were included in the study over a duration of 7 months, from March 2021 till October 2021. Patients from medical ICU, surgical ICU, COVID ICU, intensive thoracic unit, neuro ICU were included. The ocular examination was performed at bedside in the ICU. Visual acuity was for distance vision was using finger counting accelerometers, near vision wherever applicable, Snellman's near vision chart was used. Anterior segment examination, corneal surface epithelium was assessed using fluorescence strips. Torchlight was used for pupillary responses. Handheld portable slit lamp for examination was done. Posterior segment was performed after dilating with tropicamide 1% and naltrexone 0.1% eye drops half an hour before the examination. Plain tropicamide was used in hypertensive patients. And direct ophthalmoscopy performed using 20D condensing lens, and data documentation was done using M2 RedCam camera. Patients were examined in supine position. I will come to the results. Anterior segment and orbit findings. Conjunctivitis was the most common presentation. 43 patients, of whom 16 presented with conjunctivitis in both eyes and 27 conjunctivitis in one eye. Chemosis was seen in 20 patients. Exposure keratitis was seen in a total of 38 people, of which 12 in both eyes and 26 in one eye. Herpetic keratitis was seen in 3 people. Mucormycosis was seen in 6 people, of which 4 had manifestations in both eyes and 2 in one eye. Diabetic retinopathy, in posterior segment finding, diabetic retinopathy was seen in 67 patients, hypertensive retinopathy in 45. Retinal detachment was observed in 13 patients, of whom 4 had retinal detachment in both eyes and 9 having in one eye. Retinal hemorrhages was seen in 38 patients. Choroid tuberculosis were observed in 2 patients. Retinal artery occlusion and retinal vein occlusion was seen in 2 and 1 patient, respectively. Papilledema was observed in 4 people. Amongst the patients included, 25 were exclusively from COVID ICU, and the ocular findings in these patients are as follows. Mucormycosis was seen in 6 patients, diabetic retinopathy 14, hypertensive retinopathy 12, exposure keratitis in 4, conjunctivitis in 5, and chemosis in 1. And coming to discussion, previous studies have shown that the most prevalent ophthalmological problems in critically ill patients include exposure keratitis, chemosis, and microbial keratitis. During the pandemic, affected patients are more vulnerable to develop certain eye problems and complications. Developing an eye screening protocol in the ICU setting for early and regular examination facility to prevent ocular morbidity. In our study, we found ocular surface problems were easily preventable, and certain findings like papilledema helped the intensivist in management. Ophthalmic findings are important for making appropriate diagnosis. Also, some ocular conditions, if diagnosed timely, may be better managed. Documenting the profile of ocular conditions in critical care patients assists the critical care practitioner in being more aware, cautious, and being early referred to them. Thank you. Hello.
Hello, Dr. Anu.
Yes, ma'am.
Good presentation. Congrats. I wanted to ask, did you classify the patients as infectious and non-infectious conditions? No.
No, ma'am.
And pre-existing ocular and newly developed ocular symptoms, it's not classified that way.
It's not classified. I have noted that, ma'am. But in this presentation, it's not been mentioned.
There's some relevance in that, like diabetic retinopathy, pre-existing would always be there. And that's nothing new in that. Yeah.
Okay,
all right. Nice.
So, next talk will be by Aishwarya, I think. Aishwarya.
Hello. Good afternoon, ma'am. Can you hear me? Am I audible enough? Hello?
Huh? Aishwarya, is it?
Yes.
Yeah, this is Dr. Aishwarya.
Yes, you're
Am I audible?
Yeah, you are audible, ma'am.
Okay. I'll start sharing my screen. Good afternoon, everyone. Today I'm presenting my study on comparison of visual impairment in chronic kidney disease among diabetic and non-diabetic patients. Chronic kidney disease is a long progressive disease which has a strong association with ocular changes. Diminished vision is known to have a higher prevalence in patients with CKD. Studies have demonstrated that diabetic retinopathy and diabetic nephropathy have a common pathological basis. Hence, there is increased likelihood of diabetic retinopathy in patients with impaired renal function. The main aim of the study is to compare visual impairment in chronic kidney disease among diabetics and non-diabetic patients. This is a hospital-based cross-sectional study conducted from October 2019 to August 2020. There were 36 patients in diabetic group and 36 patients in non-diabetic group. All the patients underwent detailed ophthalmic evaluation along with refraction, and each patient estimated GFR was calculated. Patients above 18 years of age with stage 3 to stage 5 of chronic kidney disease were included in the study, and patients with diagnosed ocular malignancy and ocular infections such as tuberculosis and acute fulminant disease were excluded. These are the analytical methods used.
In
all
presence
the
from minus.
all of the diabetic patients suffer from type 2 diabetes mellitus. Non-diabetic group included patients with hypertension, nephrotic syndrome, nephritis, and autoimmune hemolytic disease. Out of 72 cases, 59 were male and 13 were female. The mean age group was 53.47 in diabetic group and 52.08 years in non-diabetic group. Most of the patients in this study were belonging to stage 4 to stage 5 of chronic kidney disease. 30 patients had visual impairment in diabetic group, and in non-diabetic group, 16 patients had visual impairment. This was found to be statistically significant. Patients presenting with severe visual impairment and blindness were higher in diabetic group when compared to non-diabetic group. There was a statistically significant positive correlation found between stage of CKD with visual acuity in both the groups. Most of the patients presented with diminished vision as their main complaint, but in non-diabetic group, 55.6% of the patients were asymptomatic. Most of the patients had grade 2 nuclear sclerosis type of cataract in both the groups, but in non-diabetic group, 52.8% of the patients did not present with cataract. In diabetic group, the posterior segment pathology the most common was diabetic retinopathy, and all of these patients were mainly in the stage of stage 4 to stage 5 of chronic kidney disease. This was found to be statistically significant. And most of the patients were having moderate non-proliferative diabetic retinopathy, and most of these cases again were in stage 4 to stage 5 of chronic kidney disease. The clinical significant macular edema was seen in 6 patients, and most of the patients were in stage 4 of chronic kidney disease. The other posterior segment manifestation was retinal detachment seen in 5 patients, diabetic macular edema, vitreous hemorrhage, epiretinal membrane, asteroidhallosis, pigmented epithelial detachment, modulated nerve fibers. In non-diabetic group, the most common posterior segment pathology was hypertensive retinopathy, and most of these patients were in grade 2 of hypertensive retinopathy. As you can see here, that most of the patients were in stage 5 of chronic kidney disease. The other posterior segment manifestations seen in non-diabetic groups were age-related macular degeneration seen in 5 patients, and epiretinal membrane, macular star, and pigmented epithelial detachment were also seen. When compared between both the group of diabetic and non-diabetic, most of the patients were presenting with ocular manifestation were in diabetic group, though both of the groups showed a statistically significant ocular manifestation. Discussion: when stratified by diabetes status, CKD showed a significant association with visual impairment among persons with diabetes. The prevalence of visual impairment showed significant positive correlation with increasing severity of CKD. Maculopathy was the most common cause of visual impairment in diabetic group with chronic kidney disease. In lower stages of chronic kidney disease, visual impairing changes were present in 75% of the diabetic group patient in comparison to only 12% in non-diabetic group. In diabetic group, 33.3% of the cases were suffering from severe impairment of vision, that is visual acuity below 6/60, in contrast to 13.8% in non-diabetic group. In conclusion, CKD patients suffering from diabetes mellitus were found to have higher prevalence of visual impairment, which was observed even at earlier stages of CKD. The importance of timely and frequent eye screening in type 2 diabetes mellitus and CKD patients cannot be overemphasized. The early intervention to preserve renal functions and adequate control of diabetes is key to reduction of ocular disease and prevent irreversible visual loss. Thank you.
Thank you, Dr. Aishwarya. In your presentation, I just have a doubt. What was the mean age in each group?
The mean in both the groups were around 52 years. In diabetic group, the mean age group was around 52, and in non-diabetic group it was around 53 years.
Because the cause of the group 2 you mentioned, most of them were related to age-related changes, no?
Group 2, most of the one is hypertensive retinopathy, and the second one would be age-related changes which are present in non-diabetic patients.
My question is, per se of hypertensive retinopathy will not cause loss of vision.
No, ma'am. Only patients who are presented with grade 4 of hypertensive retinopathy because of the optic edema, they had visual disturbances, but when compared to non-diabetic group, they were very minimal.
You mean all of them had papilledema and disc edema and all those things? Any optic neuropathy findings was there?
No, ma'am. In the cases in this group, non-diabetic group, there were no cases of optic neuritis.
Okay. And one more, the maculopathy is the common thing, no, for CKD.
Yeah. In diabetic group, that was one of the main cause for visual
What percentage were on dialysis then? All of them?
Out of there were totally around 20 patients in stage 5. So in that, only 8 patients were currently undergoing hemodialysis.
Okay, ma'am. Any other questions?
None of the patients had any changes in the intraocular pressure?
As far as in my group, in 72 people, all of them were within normal limits. So I didn't mention.
All right. That's not. All right. Okay.
Okay. Then we can go to the next candidate, no? 1, 2, 3, 1. Thanks, Raj. Yeah. One, 2, 3, 1, free paper. Faiza.
Hello, ma'am.
Yeah.
Am I audible?
Share the screen.
Okay. Only 2 more in video. My screen visible, ma'am?
Yeah.
Yes.
Okay, good afternoon, panelists. My study was on survey on knowledge, attitude, and practice patterns towards COVID-19 among 500 ophthalmic patients. Introduction: the SARS coronavirus 2 is transmitted from person to person through inhalation of aerosols from an infected individual. Transmission can occur within the healthcare system as well, with studies showing that ocular surfaces are potential source of infection. The detection of the coronavirus in ocular secretions also suggests infectivity. The higher viral load in the nasal cavity than in the throat suggests higher potential for transmission through close face-to-face settings like slit lamp examination and direct ophthalmoscopy. A4 tonometry generates microaerosol droplets and thus pose a risk for transmission of the disease in the ophthalmology clinic. The aim of my study was to analyze the knowledge, attitude, and practice patterns of patients attending the ophthalmology clinic during COVID-19 and also to create awareness regarding the preventive measures among the patients. This cross-sectional study was conducted among 500 ophthalmic patients above 18 years attending the tertiary care hospital from August 2020 to October 2020. A self-designed, pre-validated, closed-ended MCQ questionnaire was administered by the observer in their own local language, and the data was collected by interview method. Written and informed consents were taken, and the data was analyzed using software, and respondents were given awareness regarding correct preventive practices at the end of the session. Results: demographic characteristics. Out of 500 participants in the 52.8 were males, and most of them the inclusion criteria was 80 to 80 years. I mean, the participants were of the age group 18 to 80 years, and 51.2% were of the age group 30 to 60 years. 33.4% were above 30 years, and 15.4% were above 60 years. A knowledge assessment: the knowledge regarding symptoms, spread, and prevention of COVID-19 was good, with a mean knowledge score of 15.80, and the highest mean knowledge score was observed in the age group 30 to 60 years. The reason for presentation of these patients to the clinic was due to acute onset eye conditions in 41.2% of the participants, whereas 34% came only for regular eye checkup, and about 25% of the participants came for follow-up of chronic conditions like glaucoma. This is regarding the knowledge assessment. This was a questionnaire we have put, and we have observed that the only 48.6% knew that coronavirus can be transmitted in the absence of fever. Also, majority, about 40%, were not aware that infection can be transmitted via formats like door handles. Only 64.6% of the participants were aware of it. Attitude assessment: the overall attitude of the participants on following prevention guidelines were strong, with a mean score of 14.73, standard deviation of ±2. Majority had a positive attitude towards COVID-19 and agreed that hand wash and face masks can help prevent the spread of infection. Significant difference was noted in the mean attitude scores between the age groups below 30 and above 30 years, and it was statistically significant. The attitude of the patients were analyzed using these questionnaire. It included questions regarding using of face mask, hand wash, whether they know whether hospital visit can increase the risk of getting infection, and whether COVID-19 is well controlled in the locality. About 66.8% responded that wearing a well-fitting face mask is effective in preventing COVID-19, and 54.6% agreed that using a hand wash can prevent from getting coronavirus infection. Whereas 47.8% were agreed that hospital visits can increase the risk of getting infected. Practice pattern among the participants were good, with a mean plus standard deviation of 17.38. 50.8% of the participants knew that 2 arm distance to be maintained with the other person. 66% of the participants always wore a mask, and 56.8% washed their hands 5 to 10 times in a day, and 55% used soap to clean their hands. However, 3.4% of the patients did not use masks regularly, frequently visited crowded places, which constituted about 7.4%, and used the same mask for more than 2 weeks, which constituted about 30.4% of the study population. This way, the question is asked for analyzing the practice patterns, and about 7.4% responded that they went to crowded places during the pandemic as well. 50.8% were aware that only about 50% were aware that 2 arm distance should be kept between the individuals. And regarding frequency of hand wash, 56.8% responded that they wash around 5 to 10 times daily, and most of them use soap as for washing their hands. When asked about wearing masks, there was a 3.4%, about 17 patients who responded that they had never worn a mask. And what type of mask, the type of mask they use, majority were of cloth mask, and surgical mask was about only 16.4%, and N95 mask was used by about 10%. And we have observed that about 30.8% use the same mask for more than 2 weeks. And compare analysis of knowledge, attitude, practice score with respect to demographic characteristics. We observed that the knowledge, attitude, and practice patterns were significantly statistically significant below 30 years and above 60 years. Discussion. To date, there has been limited published data on knowledge, attitude, and practice patterns towards COVID-19 among the ophthalmic patients. Understanding the KAP among patients is valuable, considering the various amount of exposure risk that exists during their visit to the hospital. Knowledge and attitude patterns of age group above 60 years was poorer compared to the other age group. The vulnerability of this age group to infection and the poorer practice patterns calls for a targeted awareness programs focusing on older age groups. The main source of information regarding COVID-19 was TV or newspapers among 75.3% of the study population. This suggests that media should be frequently used to disseminate information on COVID-19 by the stakeholders. Significant difference was noted in the mean attitude scores with respect to the demographic variables between the age groups below 30 and above 30 years. This emphasized the need for awareness campaigns targeting these specific groups with low KAP scores. Conclusion. This study provides a comprehensive analysis of the COVID-19 knowledge, attitude, and practice patterns among patients attending ophthalmology clinic. Our patients had an acceptable awareness and on overcoming the pandemic. Considering the high number of elderly people in our study population who had lower KAP scores, targeted health education interventions and policies has to be implemented to curtail the pandemic. Thank you.
Thank you. Any questions to be asked?
So was there any knowledge transfer that happened after you realized, some of the patients had a low KP score? Was there anything that was done?
Yeah, ma'am. The awareness was given at the end of the session. We counseled them regarding the importance of maintaining social distance, avoiding crowding place, and to regularly wear masks, and also regarding correct hand washing techniques.
This is confined to general population, no, not healthcare professionals.
No, ma'am, general population.
Okay. Thank you, ma'am. We can next topic, if it's done.
Can I present?
Yeah, 1315. This comparison between Tychronolimus and Cyclosporine. Sorry, 1092. Pre-paper. Next.
Hello, ma'am.
Yeah. We can hear. Please.
Change the order. Yes, ma'am.
No, I didn't change. Yeah. The number now she is presenting is 1092.
1092.
Yeah, same order.
Good afternoon, everyone. I'll be presenting my paper today on comparison between Tychronolimus and Cyclosporine in the treatment of vernal keratoconjunctivitis. Introduction. Vernal keratoconjunctivitis is a chronic bilateral conjunctival inflammatory condition found in individuals predisposed by their atopic background. It is commonly seen in the age group of 5 to 15 years, with males being affected more than females. Steroid drops comprise the mainstay of current treatment, but their long-term and unmonitored use can lead to complications such as cataract, glaucoma, and secondary infections. Immunomodulatory drugs like cyclosporine and tacrolimus have achieved good results in the treatment of allergic eye diseases and are well tolerated according to many studies. The objective of this study was to compare the efficacy and safety of 0.03% tacrolimus eye ointment with 2% cyclosporine eye drops in the treatment of vernal keratoconjunctivitis. Methodology. 56 children attending the ophthalmology OPD at JJ Medical College who were diagnosed with vernal keratoconjunctivitis were enrolled based on the following inclusion and exclusion criteria. Inclusion criteria included children having VKC without any previous treatment or history of previous treatment with anti-allergic drugs who are symptomatic, and patients with parent or guardian who are able to follow the study-related advice and give consent for the study. Exclusion criteria included patients with any other associated ocular diseases, contact lens users, patient using steroids, and patient with presence of systemic diseases or reported hypersensitivity to tacrolimus or cyclosporine. All the subjects underwent a comprehensive ophthalmic evaluation, and based on the findings, the scoring was done. Total subjective symptom scoring and total objective sign scoring was done for each patient. Total subjective symptom scoring included the following symptoms: itching, tearing, photophobia, discharge, and foreign body sensation. A score of 0, 1, 2, or 3 was given based on the severity. Total objective sign scoring included the signs like conjunctival hyperemia, palpebral papillary hypertrophy, punctate keratitis, Trantas dots, and limbal infiltration. And again, a score of 0, 1, 2, and 3 was given based on the severity. The patients were divided into two groups. One group was treated with 0.03% tacrolimus ointment twice a day, and the other with 2% cyclosporine eye drops thrice a day. Both the groups were put on carboxymethyl cellulose eye drops 4 times a day. Steroids were never used during the course of the study. Patients were followed up at intervals of 2 weeks, 4 weeks, and 8 weeks. At each follow-up, the scoring was repeated for each patient, and patients were also questioned about any adverse effects encountered by them during the course of the treatment. Comparison was done between both the groups based on the above scoring. Results. The most common age group seen was in 6 to 10 years, where 39.3% of the patients fell, followed by 11 to 15 years. Very few patients were above the age group of 15 years and less than 5 years. Males were seen to be more commonly affected when compared to females. 67.9% of them were males. The ratio of male is to female was found to be 2:1. The most common type of BKC noted was the mixed type, followed by the bulbar and then the palpebral type. At the initial presentation, the scoring of both the groups was found to be comparable. There was no statistically significant difference between the symptom and sign scoring. However, at 2 weeks, there was a reduction noted in both groups, but the reduction in the symptoms was seen to be more in the tacrolimus group when compared to the cyclosporine group, which was statistically significant. As seen here, both the groups caused a reduction in symptoms as well as signs. However, in case of cyclosporine group, the initial reduction was lesser when compared to the tacrolimus group. The only side effect encountered during the course of the study was a burning sensation, which was noted by 3 patients at 2 weeks follow-up, which reduced to 1 patient at 4 and 8 weeks. And this burning sensation was not severe enough for any of the patients to discontinue treatment. Discussion. Vernal keratoconjunctivitis is an allergic disease which typically affects young individuals with male preponderance. Most of the patients included in this study were children with age ranging from 5 to 15 years, and among them, most of them were males. This was similar to other studies conducted worldwide. The most common type of BKC was mixed type, followed by bulbar and palpebral type, similar to other Indian studies. The baseline symptom and sign scoring in both tacrolimus and cyclosporine groups were comparable, and significant reduction was noted in both the groups at follow-up visits. But the tacrolimus group showed a greater reduction in symptom scoring when compared to cyclosporine, which was statistically significant at 2 weeks. Also, at the end of 8 weeks, it was seen that more number of patients in the tacrolimus group were symptom and sign-free when compared to the cyclosporine. These findings were found to be in concordance with those studies conducted by Lapchorin Monks and Chowdhury P. et al. However, in studies by Kumari et al. And Singla et al., no difference was found between both groups at all points of study. This difference could be because of the difference in the time duration of follow-up, difference in methods of drug preparation, and a difference in disease severity among patients recruited in different studies. Burning sensation was the only adverse effect reported by our patients in the study, which was not severe enough to discontinue treatment. At all points of treatment, there was no changes noted in the intraocular pressure, lens status, or fundus. These were similar to findings of other studies. Conclusion. Both 2% cyclosporine eye drops and 0.03% tacrolimus ointment were found to be efficacious in the treatment of BKC and safe for use in children in the age group of 3 to 17 years. 0.03% tacrolimus ointment was found to give earlier reduction in symptoms during the course of the disease within the first 2 weeks. It was also found to be slightly better than 2% cyclosporine drops in providing relief from symptoms and signs at the end of the study period. Tolerability to both the drugs was good with minimal side effects. Thank you.
Yeah, thank you. Did you do any scoring mechanism? Like what were the criteria seeing the symptoms? Symptoms were better, you were telling, no?
Yes, ma'am. The scoring was done based on this symptoms were seen whether it was mild, moderate, or severe, as in whether it interferes with their daily activities or no. And the sign scoring was again classified and scoring was done at each visit.
Okay. And most of them were children's, no?
Yes, ma'am.
Yeah. Next presentation. Any other questions?
So none of them presented with any shields or anything, because over here it says punctate keratitis. Did any of them have shields also? No, none of them.
No,
did.
ma'am. None of the patients had.
And did any of them have no improvement in symptoms at all, or rather no improvement in signs and symptoms? Did they need to be started on steroids? Did you have any patient who didn't improve at all?
One patient treated on cyclosporine did not improve at 2 weeks follow-up visit. So steroids were started for him and he was excluded from the study.
Yeah. So how many people like that were excluded? Just one, is it?
Only one patient.
All right. Okay. Thank you.
Was there any patient who could not tolerate cyclosporine or tacrolimus at all?
No, ma'am. All of them could tolerate it. They only complained of mild burning sensation, but they didn't stop the treatment.
Okay, thank you, ma'am.
Thank you.
Next free paper is 1315, Dr. Tulasi. If she is ready, she can start her paper.
Ma'am, are my slides visible?
Yeah, slides are visible. You can start.
Good afternoon, one and all. So at the outset, none of the authors have any financial interest. So in the past year, COVID-19 pandemic has caused an unprecedented threat to the public healthcare system. It's been a well-established fact that ACE2, that is angiotensin converting enzyme 2, the temporis 2, and cathepsin L are present in corneal, conjunctival, and alveolar epithelial tissue, making them highly susceptible to viral transmission. However, the ocular surface, these are present in these.
Our video is supposed to come. Our video is supposed to come.
Sorry,
Our video is supposed to come.
Hello.
Just didn't come out.
Tulsi, you should continue presenting. I think that's just a...
Okay. So making them highly susceptible to viral transmission. Now, however, the ocular surface related SARS-CoV-2 mediated immunopathology.
I don't know if it's
Now, the key players instrumental in the viral entry and replication are the ACE2, the temporis 2, and the cathepsin L receptors. Now, on the other hand, the host response is majorly modulated by interferon and myxovirus interferon-induced antiviral response against a wide range of viruses, not just the COVID-19. Now, what is the purpose of our study? The purpose of our study was to study the ACE2, the temporis 2, and the cathepsin L and other antiviral genes on the ocular mucosal surface of healthy COVID positive as well as COVID recovered patients, and how we could bring about a topical agent so that we can give COVID-19 ocular surface prophylaxis. So after seeking ethics committee approval, full globes were collected, which were not suitable for transplantation, following all precautions and strict protocols. Now, the cadaveric eyes were dissected layer by layer and stored at -80 degrees Celsius for gene expression, and they were sent for staining, for block preparation and staining for immunofluorescence purpose. Now, first part of these are my results. The first part of the result shows that the evidence of a high concentration of ACE2, which are expressed in the cornea and the conjunctival epithelium. So here, as you can see, the green color, all of this represents the ACE2 receptors. Now, similarly, another key viral attachment and entry factor, the temporis 2, also was expressed in the cornea and the conjunctiva, as you can see similarly in the immunofluorescence photos. Now, the cornea and the conjunctival epithelial tissues displayed high expression of interferon receptors, type 1 interferons, that is interferon alpha, and type 2 interferon, which is interferon gamma expressions. The myxovirus, that is MX1 and MXA, is a type 1 interferon-induced gene. Its expressions, which is a protective factor, were lower in ocular surface tissues compared to other ocular tissues. Ma'am, are my slides visible?
The slides are visible. You can continue.
Yeah, I'm so sorry. So we then conducted our study on the COVID positive globes and also the COVID recovered eyes. There were similar levels of ACE2 expression in both of them, but the MXA expression, which is an antiviral gene expression, was lower in the COVID positive eyes, from which we can infer that they had a reduced innate antiviral immunity in the cases of COVID-19 positive patients. So the expression of temporis 2 and cathepsin was high in the COVID-19 positive eyes, equally over the cornea and the conjunctiva, and later these levels actually diminished in the COVID recovered eyes. So our work, we have already published about the ocular and systemic prophylaxis, and therefore we wanted to prove it experimentally, and then we took it to the lab. Now, under aseptic precautions, human corneal epithelial cells and alveolar epithelial cell lines were treated with trehalose and chloroquine. Now, Trehalose showed a decrease in the proviral factors, but showed an increase in the interferon alpha, which actually possesses antiviral benefits. Whereas chloroquine in our in vitro study showed the opposite. So hence we took Trehalose forward into our studies. So we gave patients a 10-day treatment of topical Trehalose, and then a conjunctival impression cytology and a nasal swab showed a decrease in ACE2, TMPRSS2, and the CTSL levels. Which are the proviral factors? But then the antiviral factor, there was an increase in the interferon alpha, which actually provides or possesses antiviral benefits. And then the controls did not show any change as opposed to the Trehalose treated patients. So with this, we say that what we knew was the ocular surface and the conjunctiva is a potential route for viral entry. The risk of infection by aerosolized virus due to the presence of ACE2 is already known. But with our research and study, it added that the expression patterns of SARS-CoV attachment or entry and the interferon expression genes in the human ocular tissues is what we study. And also in the COVID-19 infected and the recovered eyes, we studied this pattern. And then we also saw the potential use of Trehalose as a prophylactic eye drop, as it reduces the SARS-CoV-2 attachment, entry genes, and enhances the type 1 interferon on the ocular surface and the nasopharyngeal tissues, and thereby preventing the entry of this virus into our systems. So reimposing again that we can repurpose medications like Trehalose, which may help us fight against this deadly virus. Thank you so much.
Thank you, Dr. Maithili. This is for the systemic prophylaxis, what you use, like this is for the topical, no? Trehalose.
Yes, ma'am. Trehalose was used topically, and that's why only the conjunctival cytology and the nasal swabbing was done, where we could actually locate the medication.
Okay. It's a good experiment, but I mean, systemic complications, though we can't prevent, no? Like many patients landed up with mucar and things like that.
This is just as an entry point. We wanted to show that even the eye could be a source of infection.
For spreading, so you can prevent the spread like that. Yeah, good study anyway. I congratulate you.
What was your control? Your control population, what was that? You said you took the COVID-19 positive patients?
Yeah. So when we took the globes from home patients, they were actually certified as non-COVID positive. But then when we repeated an RT-PCR here in our institute, we found that a few of these eyes had COVID positive, and then few we got a history that they were COVID recovered patients. So we did 3 groups, that is a control, which are normal, and then the COVID positive globes, and then the COVID recovered globes. So we saw all of these factors in all the 3 types.
Okay. Thank you.
Thank you.
Okay, the next is 1457, I think, no? The free paper.
Hello, yes, ma'am.
You are ready, ma'am?
Yes, ma'am. Should I share my screen, ma'am?
Yeah, sure. Please start.
Ma'am, is my screen visible?
Yeah. You can proceed. Slideshow, put it to slideshow.
Good afternoon to everyone. My free paper presentation is on ocular manifestations in SARS-CoV admitted patients in a hospital-based study. One of the most significant events in our recent times is the COVID-19 infection. The virus was thought to only affect the respiratory system at first, but various recent studies have suggested that ocular transmission is also possible. Ocular manifestations were mostly reported during the middle phase of the disease and in patients with severe pneumonia. This study will help us to get a better understanding of the disease and guide us to take appropriate measures while examining the patients. Methodology: This was a cross-sectional observational study conducted on 150 COVID-19 patients, which were RT-PCR positive patients admitted in the hospital from August 2020 to September 2020 during the first wave, and from May 2021 to July 2021 during the second wave of COVID. Diagnosis and classification of COVID-19 cases were done based on the guidelines provided by Ministry of Health and Family Welfare and Directorate of General Health Services, India. Ocular history and examination was done by an ophthalmology resident doctor, posted in the ward wearing complete personal protective equipment. Appropriate distance was maintained so as to prevent exposure of the infection. The complete assessment was documented and entered in Microsoft Excel. Statistical analysis was performed using software R and Microsoft Excel. As we can see here, the results are as follows. Anterior segment finding shows a large amount of chemosis in patients, with second coming as orbital cellulitis, proptosis, RAPD, and conjunctivitis. And in posterior segment, the most common findings were that of hypertensive and diabetic retinopathy-like changes, optic nerve atrophy, veno-occlusive diseases, optic neuritis, ARMD, and in few cases, bullseye maculopathy as well. Discussion. In our study, we have found that 43% patients have developed ocular symptoms 2 to 3 days after the development of symptoms due to COVID. As seen in most other studies based on ocular manifestations, the common symptom and sign associated with COVID was conjunctival congestion and mucoid discharge. The severity of these symptoms did not correlate with the severity of the infection. The most characteristic ocular manifestation in the second wave of COVID was seen to be that of mucormycosis with a very high percentage of 53.76%. In our study, the fundus findings were that of hypertensive retinopathy and diabetic retinopathy in either one or both of the eyes. These changes could be due to the existing comorbidities or their direct association to the COVID infection could not be established. Development of diseases like CRAO was also a significant finding during the second wave. In conclusion, the ocular surface is exposed to the outside environment, which may be a potential gateway for pathogens such as viruses to invade the human body. In our study aims at helping in better understanding of the COVID-19 related eye diseases by better identification of symptoms, signs, and assessment of the clinical outcomes. This will also help us in early detection, diagnosis, and prompt treatment, especially if the initial symptoms are suspected to be ocular in certain cases, if not all cases. Thank you.
Yeah, thank you. You told many were affected with mucar, no, in the second wave?
Yes, ma'am.
Okay. So how many were diabetic, or all of them were on high-dose steroids, huh?
Ma'am, all of them were on high-dose steroids, and that is why all of them had shown hyperglycemic states, ma'am.
And what percentage were diabetic as well in that group?
And all of them, the mucormycosis, all the patients were diabetic, ma'am.
Diabetic. So we saw many non-diabetic young males also, no? This pandemic. That's why I asked you.
Yes, ma'am.
Okay. Any other questions?
Did you classify your COVID-19 patients into mild, moderate, and severe, and then see if the manifestations, changed based on the severity of the COVID?
No, ma'am. We had not classified it into mild, moderate, and severe.
All right. Yeah, because that might have been, a little significant, at least when you look at the treatment, steroids not being indicated, when they're mild, right? So
yes, ma'am.
And your hypoglycemic states could probably be more related to the fact that, if you start the steroids when the patient's probably in mild or moderate, you're probably going to develop hypoglycemia. Anyway, good presentation. Thank you.
Thank you, ma'am.
Okay, thank you, ma'am. We will go to the next presentation. That is free paper 1068. You can stop sharing the slides now. Yeah.
Yes, ma'am.
Dr. Nitin, 1068.
Yes.
Is it ready? If not, the next paper, 1021, Shefali.
Can I present, ma'am?
Yeah, please start. E-scan findings, no? Your topic
Yes,
in
yes,
advanced cataract. Okay, you can start.
good afternoon, everyone. My topic is to see the writing on the wall, which was B-scan findings in advanced cataract cases during COVID-19 pandemic. Orbital ultrasonography is an efficient, non-invasive, reliable and inexpensive diagnostic technique for the evaluation of orbital pathology. Ultrasound is an acoustic wave that consists of an oscillation of particles within a medium. B-scan provides cross-sectional display of diseased tissues and is valuable in detecting unsuspected posterior segment diseases, detection of significant abnormalities using ultrasound prior to cataract surgery in mature cataracts, helps in planning surgery and allows the surgeon to provide an appropriate prognosis to the patient. The frequency used in the diagnostic ophthalmic ultrasound for posterior segment is anywhere between 8 to 12 Hertz. Studies on ultrasonographic evaluation in eyes with opaque media have shown incidence rates of posterior segment pathology to vary from 19.6 to 66%. During COVID-19 lockdown, as most of the people were unable to avail medical services and late reporting of the people to the hospital with advanced cataracts has further emphasized the need of having and using a B-scan machine for detailed evaluation of the posterior segment of the eye. Aims and objectives of the study was to determine the posterior segment pathologies using B-scan in advanced cataracts of eyes of patients who had limited access to healthcare during COVID-19 lockdown and interpretation of the findings. Inclusion criteria: all patients with mature and hypermature cataract with non-visualization of the fundus on indirect ophthalmoscopy and presence of recent penetrating or blunt ocular injury. The exclusion criteria was subjects younger than 18 years of age and history of prior ocular surgery. Materials and methods: after obtaining informed consent, every participant was subjected to detailed ophthalmic and medical history. Visual acuity was checked. Ocular examination was done using slit lamp. IOP was measured. Indirect ophthalmoscopy was done. Ocular biometry sac syringing and B-scan ultrasonography was performed using a high-frequency probe of 8 to 10 Hertz. Ultrasonography was done with contact method. Ultrasonic probe was placed over the globe with closed lid after application of the coupling gel, and then transverse, anterior, posterior, and longitudinal scans were taken. High gain and low gain sensitivity was selected during the ultrasonography. Patient features and ocular features that we believe to correlate with the higher incidence of posterior segment pathology on pre-operative ultrasound B-scan were specifically looked for and noted when present. Coming to results, in this study, out of 50 eyes with advanced cataracts, 8 eyes were found to have posterior segment pathology. So the incidence was 16%. Mean age was about 58.6. No patients had bilateral dense cataracts. The mean IOP was around 19, and 12 patients had recovered from COVID-19 infection, and 38 patients were tested negative for COVID-19. The males outnumbered the females in our study. Next, coming to patient systemic and ocular features associated with possible presence of posterior segment pathology and ultrasonography. The systemic features like diabetes was present in 32% of the individuals. About 8% belonged to younger age group. Raised IOP was seen in 10%, and keratic precipitates were seen in 4%. Posterior segment pathologies and their frequencies: retinal detachment, PVD, and asteroid hyalosis was seen in 4% of the individuals on B-scan. Posterior staphyloma and vitreous hemorrhage was seen in 2%. Based on the type of trauma, one patient gave history of blunt trauma and another patient gave history of penetrating trauma. Based on trauma, one person had retinal detachment and one patient had vitreous hemorrhage. Coming to results, incidence of posterior segment pathology was 16%. Male preponderance was seen. Out of 50 patients in this study were tested negative. Diabetes was the most common systemic disease, accounting for 32%. Out of the 12 COVID-19 recovered patients, only one patient was found to have diabetes mellitus, and on B-scan was not found to have any posterior segment pathology. 10% of the patients were found to have raised intraocular pressure. RD was seen in one patient, and vitreous hemorrhage with retinal detachment was seen in the other patient with history of blunt trauma. On B-scan followed by CT orbit in AP and lateral view, no intraocular foreign body was noted in patients with history of trauma. Retinal detachment, PVD, and asteroid hyalosis were the most common posterior segment pathologies, accounting for 4%, followed by posterior staphyloma and vitreous hemorrhage, accounting for 2% each. Discussion: the incidence of posterior segment pathology detected in our study is similar to the study which was done by Antibi et al., where the incidence was 19.6%, and Hanifem and colleagues showed that 13.87% of the eyes were found to have significant posterior segment pathologies. In a study by Haley, 66% incidence of detectable abnormalities of posterior segment was seen, which is a little high when compared to our findings. The mean age of patients was around 58 years, with a large number of males, as they're the ones who seek help earlier due to restraints in their work life. The same was reported by Llewellyn S. et al. Also, more male cases were reported in an ophthalmic research which was carried out in a developing country by Chanchlani et al. Retinal detachment was most commonly detected by B-scan by Qureshi et al., Meenakshi et al., and Jain et al., who have reported RD prevalence to be 3%, 2.5%, and 5%. RD was also reported to be found in 9.3% of the cases examined by B-scan by Mendes et al. Antibi had reported posterior staphyloma to be the most common finding. Vitreous hemorrhage was found in 2% of the patients who were also diabetic. Vitreous hemorrhage was reported in posterior segment B-scan ultrasound studies to range from 1 to 3%, which is similar to the percentage found in our study. Asteroid hyalosis was found in 2 eyes in our studies, whereas a study done by Hanif et al. Showed an incidence of 0.8%. PVD was seen in 2 eyes, which is less compared to the study which was done by Hanif et al., where 9 eyes had PVD on B-scan ultrasound. None of the 12 COVID-19 recovered patients were found to have any posterior segment pathologies on ultrasound B-scan. Most studies need to be conducted in patients with respect to COVID-19 to establish a conclusion regarding posterior segment pathology that could be picked up using ultrasound B-scan. Conclusion, we conclude that presence of certain patient and ocular features are associated with a higher incidence of posterior segment abnormalities. Patients with these features should be referred for preoperative ultrasonographic evaluation if facilities for the same are not available. There is a need to have a B-scan ultrasound machine and perform one in all patients of trauma and mature cataract for the successful outcome of surgery performed. Lockdowns which were imposed in India due to COVID-19 has further increased the incidence of advanced cataracts, thereby further highlighting the importance of performing B-scan in such eyes. Knowledge about posterior segment pathologies, which is not visible on fundoscopy, is of immense help to the surgeon in planning, executing, explaining prognosis and possible outcome of surgery to the patients. These are my references. Thank you.
Yeah, thank you, Dr. Shafali. My question is, how many of you told cataract, the media opacity mainly due to, so had LIG, like increased intraocular pressure, lens-induced glaucoma cases were there?
No, ma'am, they didn't have LIG.
Okay. And the other eye fundus was not visible among these patients?
Few patients it was visible and few it was not, ma'am.
Mm.
Like they had more of like grade 3 cataracts and it was not clearly visible.
No, with indirect ophthalmoscope, you can, in the AZ media, you can at least evaluate, no? That always gives clue for the cataractus eye.
Yes, ma'am, but it was
What's
not
happening?
that clear, ma'am.
You have not mentioned, you would have added that, and most of the findings were like stable, like asteroid and PVD and all, no? Nothing like as a
Yes, ma'am.
progressive disease. RD, what was the grade?
Yes, ma'am.
RD? You diagnosed RD?
Yes, ma'am. We had
What
not
was the
seen
grade of RD? No, was it a long-standing RD, I mean close funnel RD, or it was like, it was appearing like?
They were long-standing, ma'am. Most of it was long-standing.
Okay. Okay, man. Good presentation. Any other questions?
No.
Okay, thank you, Dr. Shafali. Then we'll move on to the next pre-paper, that is 764. Shri Kriti or Dr. Nitin, if he is available. 1068. Is there a 1068?
Hello, ma'am. This is 1068.
Yeah. Please, you finish your topic, Dr. Nitin.
Yeah, ma'am. Sure. Actually, the other one is started presenting.
You can finish, Dr. Nitin. You request them. Dr. Sri Kriti can wait, I think.
Am I audible, ma'am?
Yeah, slides are visible. You can go ahead.
Good afternoon, everyone. My topic is to compare post-cataract endophthalmitis rate in patients subjected for lacrimal syringing and Roplas for NLD obstruction during the COVID-19 time. Purpose of this study was to compare the post-cataract endophthalmitis rate in patients subjected for lacrimal syringing or regurgitation on pressure over the lacrimal sac area, that is Roplas test, for nasolacrimal duct obstruction prior to cataract surgery due to the COVID-19 pandemic. Introduction. Endophthalmitis remains one of the most dreaded sequelae of cataract surgery, and its prevention remains the crux of meticulous preoperative, intraoperative, and postoperative protocol. The lacrimal system forms an essential component of ocular anatomy, helping in tear production and drainage. Pathologies of the system, especially the nasolacrimal duct, hinder drainage and act as reservoir for bacterial growth. These bacteria, in turn, have access to the ocular surface and thus be the precipitating factor for the development of endophthalmitis post-cataract surgery. This forms the basis of checking the sac patency before performing cataract surgery. Roplas and syringing remain the two methods most commonly practiced for checking sac patency. Roplas and syringing have been compared to assess their sensitivity and specificity in detecting NLD obstruction. The COVID-19 pandemic has brought about multiple changes in surgical protocols. Sac syringing was performed prior to cataract surgery in the pre-COVID era. To minimize aerosol generation from syringing during COVID-19 times, it was shifted to Roplas test before cataract surgery. The method was a retrospective comparative institutional study for the comparison of patients developing endophthalmitis post-cataract surgery in patients who were subjected to lacrimal sac syringing in the pre-COVID time between March 1st, 2019 and January 31st, 2020, and the patients who were subjected to Roplas to cataract surgery during COVID-19 time, that was between November 1st, 2020 to September 31st, 21. Lacrimal sac syringing was grouped as Group A. It was performed in 869 patients, whereas Roplas, which was grouped as Group B, was performed in 755 patients. Eyes with complicated cataracts or traumatic cataracts were excluded from this analysis. Acute endophthalmitis was defined as those developing endophthalmitis within 6 weeks of cataract surgery. The discharge from the eye was sent for microbiological testing, which was subjected to gram stain, cured stain for identification. Appropriate treatment was started for the same. Results: a total of 1624 patients underwent cataract surgery during these two time periods of the study. In Group A, 2 patients developed endophthalmitis, whereas 2 patients developed 3 patients developed endophthalmitis in Group B. Gram-positive cocci were detected in 2 patients in Group A and 2 patients in Group B, and 1 patient of Group B had gram-negative bacilli. Discussion. In this study, gram-positive organisms were the most common isolates in both groups. Prevention of endophthalmitis remains one of the most important considerations in cataract surgery, while a myriad of factors such as older age, diabetes mellitus, and intraoperative postcapsular rupture are known risk factors for PCE. A blocked NLD also increases the risk of development of endophthalmitis. The 2011 Vision 2020 guidelines for cataract surgery in India also recommends syringing before cataract surgery. The most common microbes isolated in our series were gram-positive organisms, which were similar to observation made in previous large-scale studies. To conclude, the rates of post-cataract endophthalmitis were comparable among the patients undergoing either lacrimal sac syringing test or Roplas test prior to cataract surgery, and also indirectly suggested the efficacy between these two tests in finding out NLD obstruction pathology. Thank you, ma'am.
Yeah, thank you. The procedures are equally in diagnosing.
Am I audible, ma'am?
You are audible.
Yes, ma'am. Yes, ma'am.
Hello.
Tell me. Yes, ma'am. Tell me.
Yeah, both syringing and are equally effective. That's what you want to tell.
Actually, syringing is more better than Roplas, ma'am, but due to very less endophthalmitis cases in our institute, it was around similarly, ma'am. But lacrimal syringing is the proposed investigation to be done, ma'am, as per the studies.
Okay.
So your conclusion was there was no difference in the post-cataract endophthalmitis rates in syringing versus RHO+, isn't it?
Yes, ma'am. Because there was very specific number of patients, ma'am, in our study. It was almost similar, ma'am.
Okay.
Yes.
Thank you.
Yes, ma'am. Thank you.
Okay. Thank you. We'll go for the next free paper, that is 764. Screening for ROP is the topic. Doing their babies for follow-up on time. Dr. Sri Kriti.
Hello, ma'am.
Dr. Sri Kriti, no?
Am I
You
audible,
can
ma'am?
start the presentation.
Hello.
Yeah, audible.
Okay. Good afternoon, everyone. Today
Hello.
I'll be presenting my paper on screening for retinopathy of prematurity to parents bring their babies for follow-up on time. So retinopathy of prematurity, in that parents play a main role in ROP screening program. Our aim was to assess the knowledge, attitude, and practices among the parents of preterm babies which were screened and counseled for ROP screening. It is a prospective cross-sectional study in which the parents were subjected to questionnaire during the last follow-up of the ROP screening. And this set of questions were assessed to know the knowledge, attitude, and practices among the parents. We gave the study in 30 parents, and the mean age of the parents was 30 years. The gestational age was 32 weeks, and 43% of them belonged to lower socioeconomic status. The interval between the first counseling and the questionnaire was 1 to 9 months. The RFP screening follow-up visits were 1 to 12 times, and the delay in follow-up was in the range of 7 to 160 days. The educational status of 70% of the parents was less than 10 standard, and 80% of the parents were unskilled laborers. So, to know the assessment of the knowledge, the only few people knew the condition for which the child was being screened, and 83% of the parents knew that the child could go blind if the treatment was delayed. And also, 86% of the parents agreed that the child has to be brought for ROP screening as per the given date in the follow-up card. But only 30% of the parents brought the baby for ROP screening on follow-up date for scheduled time. The reasons given for delayed follow-up was no one to accompany, heavy rain, accident, or fear of examination, or decided to come along with the date of the vaccination, or elders in the family didn't feel that it was needed, weddings, or other causes. And the parents who came for the prompt follow-up told that the baby's eyes were important and the problem has to be detected and treated earlier. And follow-up card helped them remind about the date on which they were supposed to come. So educating parents and their active involvement during counseling improves their knowledge regarding ROP. Out of 30 parents interviewed, 20% of them could not pay attention at the time of counseling as they were stressed about the survival of the baby, and 83% of the parents were aware that ROP was a blinding disease of preterm babies, and 46% could not recollect that the blindness was due to the retinal damage. The memory of what was heard and learned during the counseling fades in a good number of parents. Most of the parents agreed that the follow-up was important for ROP screening, but in actuality, only 70% did not attend the ROP clinic as per follow-up schedule. The reasons stated by many parents appeared genuine, but in few others, it was blind excuses. Our observation on parents on compliance for attending ROP follow-up closely matches the study reported by Wernicke et al. According to the study done by Paranji et al., education and socioeconomic status affects the knowledge and awareness levels among the parents regarding eye problems. In our study, the prompt follow-up for ROP screening was observed in parents with better socioeconomic status, and the knowledge and attitude about RFP and educational level of parents did not influence the follow-up and pattern. So conclusion, the better economic status had statistically significant influence on prompt follow-up. In spite of counseling, sharing, educational concrete, and having knowledge about the blinding complication of ROP, 70% of the parents did not bring their babies for follow-up on time. Thank you.
Yeah, thank you. A good presentation. And was this study done during lockdown, or it is overall the COVID time, like 2 years you told, no?
Yes, ma'am. Huh?
No, is it only confined to the lockdown period due to COVID-19? This study?
No, ma'am. It was during 2018 to 2020.
Okay.
Hello.
Because that time, yeah, we do saw many patients not coming during lockdown, especially because of the transportation problems, no? So many will not have their own vehicles and things like that. And the complete loss of follow-up, how many percentage of babies were there?
Only 30% of the parents came for follow-up.
Okay.
Out of the people who missed.
Okay. Whether they had any complications or all those babies were doing fine?
No, one of the baby had a complication later on, which went for retinal detachment. And later on, they repented about it, ma'am.
Okay. Okay. That's very important, that crucial follow-up up to 50 weeks, no, at least.
Yes, ma'am.
Okay, good presentation. Any other questions?
Yeah, so how many of these babies, hi, good presentation, by the way. So how many babies had ROP? Are the ones that you screened?
Hello, ma'am.
Yeah, Dr. Sri. Yeah. Can you heard the question, no?
How many babies had ROP, ma'am?
Yes.
Yeah. Like how many needed laser treatment?
Okay. Very few needed, ma'am. About 5%, ma'am.
Okay. And when did you provide this questionnaire to the patients? So when did you provide this questionnaire?
This questionnaire was given on the last follow-up, when the last follow-up. The baby was screened first when they were in NICU, and they were asked to come for follow-up. And on the last follow-up, during the last follow-up, the questionnaire was given just to assess how much they knew.
All right.
No, there is like no last follow-up, no. Until the vascularization occurs, you need follow-up. Yeah. So whenever they have come, I think you have given the questionnaire, because you told one with RD and laser.
Yeah.
Okay. Good presentation. And most of the thing what I see is preterm babies, usually we discharge only later. Like if they are at 28, 32 weeks, by the time we discharge, most of them requires laser treatment. So those high-risk babies has to be followed up. We have to take the phone number and convince them, I think. Anyway, it's a good presentation regarding the awareness. Any special note on the mother's education, ma? Srikriti?
Yes, ma'am. If at all the mother was a little bit more educated, I feel they get the babies more often on the date.
Yeah. Okay, ma. Thank you. The next paper will be 1203, efficacy of oral azithromycin on meibomian gland dysfunction.
Yes, ma'am.
Dr. Tejasvi.
Yes.
Yeah, please start.
Okay, good afternoon, everybody. My topic for today is a study to assess the efficacy of oral azithromycin on the treatment of meibomian gland dysfunction. Meibomian glands are sebaceous glands present in the eyelid, which secrete lipids that form the superficial layer of the tear film to prevent evaporation of the aqueous phase of the tear film. MGD is a term that encompasses several meibomian gland disorders, which may be hyposecretory or hypersecretory, most commonly being hyposecretory due to obstruction of the glands.
Disruption of MGD function negatively impacts both the quality and quantity of the mebium secreted, which in turn affects the ocular surface health through changes in tear film composition. Increased tear evaporation, hyperosmolarity, inflammation, and ocular surface damage can subsequently occur. This may cause discomfort, visual disruption, and sensation of the dry eye. Signs and symptoms are mainly dryness, burning sensation, itching, foreign body sensation, and eyelid swelling. On slit lamp examination, the signs include plugged orifices, margin redness, bulbar conjunctival redness, reduced TBUT, and ocular surface staining. The treatment which we commonly use is conservative, which includes warm compresses and eyelid massage. Pharmacological treatment is mainly topically eye drops or eye ointment of azithromycin and lubricants. If this does not work, we go for the systemic management with usually tablet doxycycline and tablet azithromycin. As I said above, the measures, that is the conservative measures, the patient will need to be compliant to them and go on using them for long periods of time due to chronicity of the disease, and hence they can prove to be ineffective in the long run. So we started the study to know the efficacy of azithromycin on the treatment of meibomian gland dysfunction. Methodology, it is a hospital-based interventional study. The source of patients were the patients visiting the outpatient department of tertiary eye care center having signs and symptoms of MGD. 40 patients were taken into the study and it was conducted in a period of 2 months. 40 patients presenting with symptoms of dryness, burning sensation, itching, foreign body sensation, and eye. Slit lamp examination was performed and the quality of meibomian gland secretion, plugging of the orifices, bulbar conjunctival redness, eyelid margin redness, TBUT, and ocular surface staining were noted and grading into grades 0, 1, 2, or 3 according to severity. One eye of each patient was used for documentation of the signs and symptoms, and the patients found to have other ocular surface disorders were excluded from the study. So the grades of signs and symptoms were graded according to this questionnaire, with itching, for the symptoms, grade 0 being no symptoms, grade 1 being mild, moderate, and severe, as grade 1, 2, and 3. And the signs were, when seen on slit lamp, were according to this. The patients who were under the study were given oral tablet azithromycin 500 mg BD for day 1 and OD for 4 days to be taken after food. The patients were asked to review on the 5th day of treatment and the same signs and symptoms were recorded along with any side effects experienced. The patients are also reviewed on day 30 of starting treatment and the signs and symptoms were recorded again. Results: out of the 40 patients, 38 patients completed the full antibiotic course with a compliance of 95%. Distribution of signs and symptoms at the time of diagnosis, as we can see that more than 25 patients, that is more than 50% of the patients were falling in grade 2 and around 20% of the patients had already grade 3 of symptoms. Also the signs, about 50% had grade 2 or more, and very less people, that is less than 5 patients, had grade 1, and grade 3, about 20% had grade 3. On the 5th day of the treatment, most of them had shifted to grade 0, that is they had no itching, foreign body sensation, dryness, burning, or eyelid swelling, and more than 50% of the patients had shifted from grade 3 to grade 2. This was also the case for signs, that is about 20% of the patients had grade 0 and more than 50% of the patients had grade 1. Also, the patients were reviewed on the 30th day and they had still maintained the signs and symptom ratio that we had seen on grade 5, that is more than 25% of the patients had still no symptoms and 50% of the patients had only grade 1 symptoms. Also, the signs on the day 30th, about 20% of the patients had 0 signs and more than 60% of the patients had only grade 1 signs, but ocular surface staining and T-BUT had shown more than 10% having grade 3. Side effects were also measured, if at all, and about 82% of the patients did not have any side effects. The major side effects experienced were nausea, decreased appetite, abdominal cramps, and diarrhea in 11% of the patients. This was applicable only for the 5 days on which they were receiving the medications. After that, they had no symptoms whatsoever. Statistical analysis was done. Well, we compared all the signs and symptoms on the first day to the 30th day using chi-square test, and for more than 95% of the patients, they had an improvement of grade 1 or more. In conclusion, all the signs and symptoms of MGD had reduced significantly on day 5 as well as day 30. Less than 13% experienced adverse side effects which lasted during the treatment period. Tablet azithromycin is hence safe and effective choice for treatment of severe MGD and wherever compliance with conservative management is proved difficult. In our study, tablet azithromycin has shown to control MGD even after its treatment period of 5 days, although it cannot be generalized due to small sample size of the study. Thank you.
Hello, Dr.
Hello.
Tejasvi.
Yes,
Hello, Dr. Tejasvi.
Yes,
did you compare the patients who also, other than the azithromycin tablet, continuing hot fermentation and patients who didn't do that? Did you do any comparison that way?
No, ma'am. Actually, these patients, we encourage them for the sake of the study to only be on tablet azithromycin and
no
not do
concurrent charges.
No
Okay.
conservative management.
And lubricants also? No lubricants were
No,
given?
ma'am. No lubricants were given.
Only azithromycin was the mode of treatment, is
Yes.
it?
Yes, ma'am.
Okay. And still you saw improvement in symptoms? Okay.
Yes, ma'am.
All right.
No, my question is, any of these had any coexisting systemic morbidity or any ocular surface disorders like
The people
MGD?
The people who had other ocular surface disorders were already included in the exclusion criteria, so they were not taken under the study, ma'am. And 30 people out of the 38 people were diabetic and hypertensive.
Okay. Okay, any other questions? If no, like we can go for 1358, that is ocular morbidity among all patients. Yeah, thank you. The next free paper, 1358.
Hello, ma'am.
Yeah, we can hear you. Please share your presentation.
Good afternoon, everyone. I, Dr. Raulapati Vinil Sai, second year postgraduate student from AIMS BG Nagara. Respected judges and chairperson of the session, today I am here to present a paper on ocular morbidity among COVID patients in a tertiary care rural hospital. Severe acute respiratory syndrome coronavirus 2, which is responsible for the novel pandemic coronavirus disease, has been challenging the medical community since then, with over 33.8 lakh cases reported in our country till October 2021. While most of the diagnostic and therapeutic efforts have been focused on respiratory complications of the disease, several ocular morbidities have also been reported. In a study done by Ping Wu et al., 1/3 of patients with COVID-19 had ocular abnormalities, which frequently occurred in patients with more severe COVID-19. Although there is a low prevalence of SARS-CoV-2 in tears, it is possible to transmit via the eyes. Aim of the study is to assess the ocular morbidity among the patients with COVID infection. Materials and methods. It is a prospective study done at the Ophthalmology Outpatient Department at AHRC. The study duration was from June 2020 to August 2021. And the study subjects were the patients who attended the OPD. Sample size of 16 patients. Inclusion criteria, all patients visited during the COVID pandemic first and second waves. Exclusion criteria, patients with pre-existing ocular morbidities. After detailed clinical history, patient underwent routine ophthalmic examination, which included best corrected visual acuity with Snellen's chart, retinoscopy, slit lamp examination for thorough anterior segment evaluation, intraocular pressure, and dilated fundoscopy. All the suspected COVID-19 infection patients have been undergone for RT-PCR testing.
Maybe on the presenter's side, because I can still see the slide, but I guess we've lost the presenter.
Signal, yeah, we can hear you now.
Yeah, sorry.
No, you can start from where it got disconnected.
Yes, ma'am. Discussion in our study, we found that 16 patients had significant ocular morbidity in relation to COVID-19 infection. In our study, viral retinitis was the most common ocular morbidity seen in 56% of study population. This is in concordance with the other study done by Invernizza et al., in which they found that the COVID-19 can induce important changes at the level of retina, most of them affecting the retinal vasculature and particularly veins. In our study, 31.25% patients had developed conjunctivitis, which in concordance with the study done by Villahouse G et al. They stated that the conjunctivitis or tearing can be the first presentation and even sole manifestation in a patient with COVID-19 infection. In our study, mucormycosis was seen in 12.5% patients. This is in concordance with the study done by Singh et al., who reported overall 101 cases of mucormycosis in people with COVID-19, of which 82 cases were from India and 19 from the rest of the world. And a study done by Mishra and et al. Have proposed that patients with COVID infection are susceptible to mucormycosis because of impairment of barrier defense, dysfunction of phagocytes and lymphocytes, and use of immunosuppressive medications such as steroids and tocilizumab. Conclusion: viral retinitis was the most common ocular morbidity in our study, and this pandemic has changed our lives in many ways, and various ocular morbidities were seen too, of which few cases occurred with timely diagnosis. These are my references. Thank you.
Yeah, thank you. Viral retinitis, you told, the most common.
Yes, ma'am.
Hear me. Did you rule out all other causes for that condition, like?
Pardon?
No, other causes were ruled out in patients. At what time they presented, like along with
viral retinitis was presented post 2 weeks of their hospital admission, ma'am. Like discharge, post 2 weeks of discharge.
How many weeks?
After discharge.
No.
2 weeks after discharge.
2 weeks after.
2 to 3 weeks, ma'am.
Okay. Was there any macular involvement in these cases?
In our 9 cases, no, ma'am.
No, only peripheral vasculitis.
Peripheral lesion, yes, ma'am. And mucormycosis was presented after 3 weeks of their discharge from the admission. So as we doesn't have the mucormycosis treatment ward, we have referred them to Rangadore, Bangalore.
Okay, good presentation. Any other questions?
No.
Okay, then can we proceed to the next, that is 1266, Dr. Deepak?
Yes, ma'am.
Yeah, you can start sharing.
Good afternoon, everyone. Ma'am, my slides visible, ma'am?
Yeah, it's visible.
Carry on.
My topic is accuracy of direct imaging of gonio mirror by smartphone, that is DICS technique in the grading of angle of anterior chamber. Coming to introduction, gonioscopy is biomicroscopic examination of anterior chamber angle of the eye, where aqueous gain access to the Schlemm's canal. Gonioscopy allows visualization of anterior chamber angle by using direct or indirect contact lens to overcome total internal reflection. Gonioscopy helps in classification of the glaucoma based on, by assessing if the angle is open or closed. It helps in observing various pathologies involving the angle structures. Since it's a difficult and time-consuming procedure, most of the ophthalmologists doesn't practice gonioscopy on a routine basis. Glaucoma evaluation is never complete without gonioscopy. In recent era, almost everyone has smartphone, which can be used as a tool for grading anterior chamber angle with gonio lens without requirement of slit lamp. Smartphone-based gonioscopy was first introduced by Neelish et al. In the year 2019. My objective of the study is to evaluate the accuracy of direct imaging of gonio mirror by smartphone technique in grading of anterior chamber angles. Coming to materials and methods, It was a cross-sectional study which included 30 patients who were attending the ophthalmic OPD and were taken consent, and gradable angles were included. All the patients who will first undergo the routine ophthalmic examination, followed by imaging by smartphone, and then we make the patient to undergo standardized slit lamp examination from a mass glaucoma consultant, and the results were confirmed. This direct imaging of gonoscopy screening include application of a drop of topical anesthesia in the eye to be examined, then lubricating drops into the 4-mirror gonio lens, and then the gonio lens is placed in the cornea using a smartphone in a video recording mode with 3/4 zoom and flashlight on at 1 to 2 inch distance, focusing on all the angle structures, then revisualizing the video, and the angles were graded. After this, the patient underwent the slit lamp examination by the mass glaucoma consultant. My results are that this 30 patients we have examined who are in the age group of 40 to 70, 40% were females and 60 were males. 80% patients had gradable angles, out of which 70% results of DIGS correlated with slit lamp gonioscopy. The limitations of the study were the degree of the pigmentation, iris processes, sample release line, and neovascularization couldn't be assessed. These are some of the images captured from DIGS. Left image shows inferiorly iridectomy with trabecular ostium in the superior angle, and the right image showed all the 3 structures. The left image showed intraocular foreign body lodged in the inferior angle, and the right image showed iridectomy in the superior and the nasal. Coming to the conclusion, apart from routine smartphone-based imaging of the retina, it was the first time where DIGS was compared with the slit lamp gonioscopy. It is an effective tool to visualize the angle structures for early detection of glaucoma in outreach camps where slit lamp access is not available. It can be used in physically handicapped patients in whom slit lamp cannot be used. It can be used as a teleconsultation with glaucoma specialist. It is easy for storage and for follow-up on subsequent visit. The skill of DIGS can be trained to an optometrist or any skilled worker for screening in the peripheral camps. It can be used as a potential teaching tool and for counseling the patient for further management. We are planning to continue the study on a large number of patients for accuracy. These are my references. Thank you, ma'am.
Thank you. So how many patients you really did prophylactic PI based on this? Or confirmed that they were of narrow angle?
Ma'am, based on this, we didn't do prophylactic PA, ma'am. We were actually, after confirmation with slit lamp, we planned for the further management, ma'am.
No, I know. I mean, we were able to diagnose any cases which really required any intervention.
Ma'am, that intraocular foreign body case, we could able to, which was lodged in the inferior angle, we could able to diagnose, ma'am.
Okay. What was the symptoms of that patient?
Ma'am, he came with redness and all, ma'am. He had 1-2 years back, he had a history of trauma, ma'am.
Okay, that's very important. They may come as an uveitis like picture. Anyway, good presentation. Yes, any other questions are there?
So you didn't use the slit lamp at all, right? You just used the phone with the foam mirror and you recorded just with that, is it? So did you have any other additional fitting into your camera, like how for the retinal imaging you have an extra fitting, right, to place on top of the, your phone? So did you have anything like that? Any additional fitting? No?
No, ma'am. It's just the camera with we should make 3/4 zoom, and we should make the flashlight on, and in a video recording mode, we should just we should record all the angle structures. Then we should revisualize it so that we can grade the angles, ma'am.
Okay. So one person's holding the gonio mirror and one person's taking the recording, or are you able to stabilize with one hand and record with the other hand?
No, ma'am. I am alone doing with stabilizing in one hand and recording, ma'am.
Okay. So then it's still doable. Okay, good. Very interesting.
Thank you.
Good presentation.
Okay, thank you. Then we'll go for our last talk, that is 897.
Hello.
Yeah?
Yeah, we can hear you. Carry on.
Yeah.
Screen is visible?
Yes, yes. Doctor.
Yeah. Please start.
So I'm presenting a paper on the challenges for ophthalmologists during COVID era. My chief author is Dr. Prajwali Reddy, and ophthalmologists are one of the medical specialists, though most exposed to the risk of SARS-CoV virus due to the nature of their work, because they are being in close contact with the patients during routine ophthalmic examination. With the spread of COVID-19, many ophthalmologists have had concerns and fears regarding the possibility of having to close down the clinics, or they were limited to practice only to the emergency cases. As the COVID-19 pandemic is spreading around India, the All India Ophthalmology Society had recommended the ophthalmologists restrict seeing patients only to the emergency cases. It also recommends proper patient screening and using proper protective equipment. Postgraduate residents in the teaching institutions are affected regarding the training program with reduction of all elective surgeries. Objectives: this is a survey-based study to evaluate the challenges faced by ophthalmologists following the national lockdown period, material and the methods. The self-administered anonymized questionnaire consisted of the questions designed to evaluate the challenges faced by ophthalmologists immediately following the lockdown period in their respective practice area in various parts of the India. The questions covers the various parameters, including the demographic details, the type of their practice, challenges faced post-lockdown, and the economic implications. And these are the results. And we got a total 160 responses. In that, 71% of the ophthalmologists were in the age group of 30 to 40 years, and 10% in 50 to 60 years, 18% were in 20 to 30 years. And in type of ophthalmic practice, 8 ophthalmologists were practicing in government hospital, 20 in medical college, 40 were postgraduate resident, 64 were practicing in private clinic, 16 in charitable hospital, and 12 were practicing in corporate hospital. And this is the post-lockdown effect on clinical ophthalmic practice. Here, the 15% of the respondents, they have started operating within the 2 weeks, whereas 25% they took 4 weeks, and 60% they took more than 1 month. So what was the impact on the surgical workload? During the post-lockdown period, the number of surgery performed, it has been reduced significantly when compared to pre-lockdown times. 60% of the respondents, they reported a 75% reduction in their surgical workload, while 40% stated reduction of the intraoperative reduction of more than 90%. 12% felt intraoperative surgical time has been increased, whereas 28% felt that there was no change. Also, during the same period, 60% of the participants did not feel completely satisfied with the quality of their surgical procedure, as where 40% were satisfied. 40% of the former groups, they said that they were uncomfortable with the new standard operating protocols. 22% said that the patient were uncomfortable with masks. 18% said that they were very hesitant to begin the operative procedures. So these were the measures taken by the various ophthalmologists to prevent the spread of COVID-19. Use of face shield was done by the 20%, and use of hand sanitizer and hand wash by 50%, use of protective film on microscope and slit lamp by 50%, and 99% of the ophthalmologists, they were compulsory using masks as a measure to prevent the spread of COVID-19. And for additional investigation before operating, they have ordered the rapid antigen test in 80%, RT-PCR in 20%, 8% has ordered chest X-ray, and 2% have not done any additional pre-op investigation. Now, these are the challenges faced during operating procedure regarding the aseptic protocols. We can see that majority of the ophthalmologists have COVID concerns inside the operating procedure. And the post-lockdown effect on the cataract surgery. Responding to the post-lockdown estimate of cataract surgery performed, a hike in surgery was seen in the mature cataracts. Nuclear cataract was seen for 33%, while the rest were traumatic and hypermature cataract. 52%, they have lost their patient for follow-up. And these are the slides showing the effect on the revenue generation. It has been significantly affected in that the ophthalmologists were having 45% of the ophthalmologists were having 50% reduction in salary, 25 to 50% were having 20% of the ophthalmologists were having 25 to 50% reduction in their salary, and more than no salary was given in to the ophthalmologist, about 20%. And this is the post-lockdown financial state. Job was lost was seen in 10%, and 20% ophthalmologists were working in low salary. 5% of the ophthalmologists have change of workplace, and 65% don't have any effect. So discussion, the reduction in workload was seen among our colleagues, and it can be due to multiple reasons, like fear of getting infected with COVID-19 from patient, and assisting healthcare providers, non-availability of the transportation. There was a lack of staff, and medicine and support services. Everything was not there, and they are having very difficulty in using the PP kits. And we can see that most of the ophthalmologists were cataract surgeon, and we can see the most common cataract was seen is mature cataract, which signifies the postponement of less visually impairing forms of cataract by both the patients and the ophthalmic surgeon. Most respondents in our survey suffered significant revenue loss, which can be attributed to reduced workload or the salary cuts. Due to the reason discussed, COVID-19 pandemic had created a psychological impact on practicing ophthalmologists throughout the country, which may necessitate the individualized mental health care, especially for those with having mild and severe depression. Conclusion, our study has focused the challenges the ophthalmologists are dealing with during COVID-19 pandemic. It is clear that not only just the eye care has been greatly impacted, but also the healthcare personnel have been impacted on variety of the levels, including the financial losses and psychosocial factors. Thank you.
Thank you. Any questions are there? You told depression also, no? 40% had depression, and there is significant reduce in the number of surgeries.
Yeah.
What was the cause for that? Was there any particular financial or the fear of the infection?
Actually, it is multifactorial, ma'am. They have responded that they have fear of getting infection, and surgical workload has been reduced very large.
Okay, and also you told many were not satisfied. Why? With their treatment?
Because many of the surgeons, they have told that they have having increased surgical time because they are operating after more than a month, so might be having problem with that.
Okay. Any changes in the OT has been done? Because many were
like they are having more post-op complications, ma'am, and more surgical time, and mature cataract are usually having more post-op complications.
Okay, nice presentation. Any other questions? we are at end of the session. I would like to thank Dr. Rashmi and Dr. Subhashri being with me in this session, and Dr. Ellen sir for giving an opportunity to judge this session. Thank you all.
Thank you, ma'am. Thank you,
Thank
Dr.
you.
Rashmi.
Yeah, thank you.